Hey everyone, welcome back to Insulin Inspired. Today we are diving into a topic that baffles many diabetic patients and even sometimes healthcare providers. What in the world is happening to my blood sugar when I drink alcohol? Let's jump in. So understanding how alcohol impacts your blood sugar starts with understanding how the body is managing your blood sugar when you're not drinking. So normally the liver is making a trickle of sugar all day long for us. We need the sugar to make energy for all of the things that our body always has to do, even when we're sleeping. Keeping our heart beating, keeping our lungs breathing, all of these kind of things that the body's doing all day long. The liver is just making this nice little trickle to help support that throughout the day. If you're using a long-acting insulin product, anything like Lantus, Tresiba, Toujeo, insulin glargine, lots of others, but those are just some examples, or you're using an insulin pump, the basal rate in the pump, these things are designed to match the amount of sugar that the liver is making in your body. Everyone's doses are pretty different because it depends on what your liver's doing, but those things are designed to match. So what happens when we throw alcohol into the mix? Well, when we drink alcohol, our liver sees the alcohol as poison. It wants to get rid of it. It knows it's a problem. So it prioritizes getting rid of that poison. And because of that, it decreases or stops producing that little trickle of sugar that it's normally making. So when we first drink the alcohol, we'll often see the blood sugar start to rise from the sugar or the carbohydrates in the alcohol. That's particularly true for higher carb alcohols, things like beer, sweeter wines, fruity cocktails that are mixed with a lot of sugary things. So we'll see that initial rise, but then later, unfortunately, often after we've gone to bed, the blood sugar can start to drop and sometimes can drop pretty substantially. So the amount of drop that we see depends on how much we drink and how big of an impact that has on our particular body. So something like one beer or one glass of wine will have a smaller impact than in a case where we're doing vodka shots all night, because the liver is going to stop making sugar for a much longer period of time and may even completely stop versus decreasing when it is processing out that higher quantity of alcohol. So what do we do about this? Well, there's a few things that we can do. First of all, those larger quantities of alcohol are a much bigger problem. So we need to be a lot more aware and cautious if we are drinking bigger quantities of alcohol. And again, in an ideal world, we'd probably want to minimize that. If we are using a basal insulin product, an insulin pump, or even more importantly with something like Tresiba or Lantus, Toujeo, you're going to want to have a snack before you go to bed. Ideally something that's a mix of carbohydrates and some protein to help stabilize the blood sugar throughout the night. So something like some cheese and crackers or an apple and peanut butter, something along those lines to kind of help get you through the night. If you're using an insulin pump, they have some more advanced features. So rather than having a snack before bed, a much better option is to do something with that basal rate overnight. You can decrease it. There's different ways to do that using features like temporary rates or activity or exercise modes. I'll have future videos on that. If you want some more information on how to use those features, go ahead and watch those videos later on. And then the other thing that's super important for any diabetic drinking alcohol is to make sure that when you're drinking alcohol, you are with someone who knows what diabetes is, what low blood sugar is, what those signs and symptoms look like, and how to help you out if you are to have an issue. Hopefully that eases some of your confusion around alcohol use in diabetes. For more diabetes information, go ahead, head over to my channel, watch a few more of my videos.